People have asked me, what is the big deal in regulation? You don't mind if I discuss this in this, do you? Because it is quite important. This is where the difference is between whether you go and have it done in a salon by a beauty therapist who is trained in doing things, and you don't know the difference until things go wrong. Because when something happens and the person who treated you is regulated by somebody higher up, so if it's a nurse who is regulated by the nursing register, or a midwife, or a doctor who is regulated by the General Medical Council, who are known to be like, it's like a total, they'll come at you with pitchforks and torches if you harm a patient. And our PIN numbers are very important to us. So we will do anything to protect our patient. And believe me, there are no clients in these treatments. When a doctor sees a patient, the person is a patient. And I would treat them as a patient. I am a GP. I would not offer private services to a patient who is an NHS patient under my care. Now that is part of the GMC ethics. There's the new regulations for cosmetic treatment from the GMC. It is regulated, believe it or not. There are so many things we have to do like any other medical treatment. And we have to remain on that register. And that is the standard of care you get from a doctor who is trained to do this and who is actually proven that they are doing this to a high standard over a period of time. Not someone who has taken 2 days of training. The GMC actually expressly forbids people who have not had 10 logged accounts of that treatment supervised by someone who's experienced in it. Just the same as doing a hernia operation. We used to get it signed off. We have to get these things signed off now before we do it. So none of your 48-hour trainings in doing it. So having said that, and then there's a medical insurance. I shouldn't probably be saying this, but we have to be insured for up to 5 million for any damage, but don't take that as a reason to sue me, because I won't do anything for you to sue me for. And then act within our own competence, which means don't do anything that the insurer hasn't checked out that you can do. So no testing things on patients. No trying out something saying, oh, the patient wants it, let's do it, because they're paying for it. No. And if the patient comes and says, I'm paying for it, you got to do it, I will tell him where to go.